Hello, everyone. Thank you so much for joining us today. My name is Adrienne, and I am the co-chair of the Pink Triangle Committee at the Hospital Employees Union. This year marks 25 years of equity committees at HEU, and we are very excited to be celebrating this important milestone. I'm calling from the traditional, ancestral, and unceded territories of the Syilx, Okanagan First Nations people. As we learned in our last webinar, land acknowledgement like this are just one very small step towards reconciliation and must be accompanied by action. To learn about the traditional territories you are on, you may visit nativeland.ca. Please feel free to share in the chat the territories you come from. I am pleased to be introducing our session today on the topic of mental health and wellness for LGBTQ2S plus people during COVID-19. The pandemic has spotlighted and exacerbated mental health issues across the board, and this is especially true for marginalized populations such as the LGBTQ2S plus community. This community has had a long history of supporting one another in building self-love and well-being. The Pink Triangle Committee at HEU has a proud history of fighting for equity and justice for LGBTQ2S plus members and our community as a whole. It's been difficult to continue this work during COVID-19 pandemic, but our commitment remains strong. I am pleased to introduce HEU President Barb Niederpel, who will be hosting today's webinar.
Thank you so much, Adina, for that introduction to our topic tonight. And thank you so much for your ongoing work on the Pink Triangle Committee. And to everyone else on the Pink Triangle Committee, we are so proud of the work that the HEU Equity Committees produce and on very important issues that they take on. So anybody that is on the committee, please, if you're watching tonight, feel free to introduce yourself in the chat so that we can celebrate you and the work that the committee has been doing on behalf of the LGBTQ2S plus members. Good evening, everyone. I am joining you this evening from the unceded and traditional territories of the Secwepemc people. My pronouns are she and her, and I am really excited to be hosting this evening's webinar. As Adina mentioned, mental health and wellness is of the utmost importance these days, especially to combat the challenges of isolation. LGBTQ2S plus people have been disproportionately affected by this mental health crisis. But there's also exciting work that is happening to improve wellness in these communities, including the work of our two panel speakers today. And I'm very proud and honored that they are with us to talk more about it. So first we have Adrienne Smith, is a well-known speaker in the labor equity circuit. They speak on issues of trans justice and racial equity. And Adrienne is a lawyer who has recently worked for the Canadian Labour Congress, and now they have a private practice. Thank you so much for joining us today, Adrienne.
For having me, and thanks everyone who's joined in. I know folks have busy lives, and it's really important that we've been able to come together tonight.
That it is. And our second speaker joining us today is Gina McKay. Now, Gina recently released a CUPE national document on LGBTQ2S plus workers and safety in the workplace. She is currently working for her local labor council and working to get elected to CUPE Manitoba Executive Board. And it's great, so great to have my sister Gina McKay out of CUPE with us here tonight as well.
Great. Thank you so much, Barb and Adrienne. I'm looking forward to the discussion.
I feel that those introductions are such a brief snapshot of how accomplished and well-respected both of you are within the labor movement and in our communities. So I'm so excited that for the next 45 minutes that I'm going to be asking these questions of both of you, and I can't wait to learn and hear so much more from both of you. This is such a great opportunity for us to learn and engage with experts in this field. And so for those of you who are watching live, if you have at any time through this webinar, if you have any questions, just put them in the chat, and we will aim to have at least at the end about 10 to 15 minutes so that we can address some of those questions. So put them in the chat as they come up, though, so that you don't forget them. Without further ado, I think we need to jump right in because there's so much to talk about. And I'm going to go in no particular order. So whoever actually wants to jump in first, let's do it that way. So to either of you, tell us more about why this particular topic is relevant and how the pandemic has affected well-being for LGBTQ2S plus people, in particular about mental health.
If you don't mind, Gina, I think there's three big areas where this is a really critical issue for queer and trans folks. And I say that not to suggest that our community has a monopoly on hard times in what has been a global catastrophe, but because it's undeniable that queer and trans folks often live their entire lives farther from justice than the rest of the community does. And what that means is that when the pandemic hit and there was this tremendous contraction of the economy, folks lost their jobs and suffered incredible losses of employment. And because discrimination in the world disproportionately affects our community, what that meant was that there was a greater proportion of queer and trans people who were laid off, who had been precariously employed to start with and had their hours cut. And a related issue of precarious housing. And that meant that people who are living in houses they don't own and places from which they can be evicted were evicted, particularly when the freeze came off. They found themselves in situations when they couldn't self-isolate and they couldn't rely on some of the safety that better off folks have. I think also this community's really dire problem accessing healthcare was exacerbated by the pandemic, not just because all of medical resources were focused on keeping people alive, but because many of the places, particularly where HEU members work, that are providing community social services and really critical living rooms and critical social and healthcare services that folks don't get through a family doctor, don't get through a community health center, just closed, and there was nowhere for folks to go. And that had an impact on workers who are members of our community who lost touch with their community, but particularly for folks who are necessarily need to access services. What it meant was that folks were alone, they were unsupported, and they were sometimes doing that in places that were unsafe without any kind of savings or benefits or security. And that's a union issue because it has to do with precarious employment and how we need to extend better working conditions and job security and benefits to folks. It affects us as good members of the community because the services that we deliver are things that people really rely on. And that was made super clear when suddenly those services just weren't there.
Mm-hmm.
Yeah, that's a lot of layers to that, Adrienne. Thank you. Gina.
Yeah, thanks, Barb. Building off of that too, Adrienne, I think it's really important topic of discussion for sure, but not only relevant to the labor movement, but also it's the heart of the work that's needed, I think, to ensure that equity workers are at the core of the way all of our work sectors need to build stronger recovery strategies as well. So I think it's highlighting that. No matter what, there's been added strain, just as Adrienne's mentioned, impact to those who identify in the community, of course. But then also there's a heavy lean on some of the structures and legislation I think that we have in place to accommodate and better understand some of those psychosocial health and safety provisions regarding mental health and wellness. So I always like to talk about wellness as well, because we look at those two pieces together. And sometimes that's what's missing from some of our work, from some of our language, etc. And, we're in the middle still, I would say, living through this pandemic, and it's a shifting world. for each one of us, it's changes and challenges. And I think not just as workers, LGBTQ2+ workers, but we're also community members. We have our own lives and worlds outside of our workplace, and all those compounding pressures and impacts in each one of the realms, right? And I think that type of intersectionality, when we look at that, when we talk about it this evening, is really important to focus on, because it's, it's the social or physical distancing, there's economic strain, job security, access to inclusive and I would say social programming as well, housing instability, all these things that have been fueled by the pandemic. And I think, LGBTQ2+ folks are disproportionately affected in all of these areas. But I think what's also in sort of a last piece too is, before the pandemic, even before, the systems and institutions that have been in place already to support mental health and wellness already needed advancement, right? So then we go through these major changes, and now what we're really recognizing is there's even further push to the fringes.
I think that distinction that you made between wellness and health, I think is critical, because being well doesn't just mean you have an emergency room you can go to, and it has to do with where we're getting care. And I think that just incredible system under strain that was under-recognized to start with, when people consume things that kept us well, including all the social programs that we know are indicators of health that hold people together, when those things were just in a crisis that I think has become regrettably quite permanent. And I think it's an invitation as much as a tragedy for us to think about what we're going to do in a world now, knowing that those systems that we had already recognized were unreliable aren't there for so many of us. I think there's an opportunity there for hope and for faith and for building.
Mm-hmm.
Absolutely. So with that being said, that was a very, very thorough response from both of you. But so in your experience then, what are some of the most common misconceptions about mental health and wellness for LGBTQ2S+? Gina?
Yeah. I would say, thinking about that, I think I would sort of theme my answer, my thoughts around that LGBTQ2+ specific program. So I'll explain that a little bit further. So I think some of the most common misconceptions that I've learned in almost 20 years of working in the social service and community health sector is that LGBTQ2+ persons need referrals to LGBTQ2+ specific service providers. And so in many cases, service providers are redirecting client or a person who access services access to either one or two of the out workers that are there by default, or sometimes it's a deflection, I would say, around some of their personal values and sometimes their personal bias. And what comes along with bias are misconceptions and assumptions about the community without engaging in the discussion. So for me, I think if we can look at instead of building safer and more inclusive spaces for all workers for accessing services, right? That it doesn't have to be, talk to Gina at CUPE or United Way because she's queer, right? It's that type of a mentality. And so if we can move away from that sort of special interest, and then I find a lot of programs and services default to that, then we can sort of redirect and address that the community is finding and making referrals themselves. And so to be, to understand that is to know, if I'm looking for services, I'll say, does anyone know of a chiropractor that's inclusive? Or is there a dentist that's not transphobic? And we that exists already. So in my community, we do that through shared social media groups, etc. And the ways as labor, like as a union, that we can come together is to bring those conversations and spaces to the table so that we can identify and address those misconceptions. is one piece that I'd share. And then the report. So Barb, you had mentioned that it's got to be about safety report, and we'll share the link for that. It's a report that was done, and there's HEU members, there's CUPE members, just a wonderful group of people that shared their experiences. And it's that it's not just about the worker, it's about those who are accessing the services. If it's not safe for them, it's not safe for the worker, and it's not safe for the family, friends, community that then support them in that space. So I would say really getting at that misconception that you have to have specific services when we could look at how do we make that environment safer in the first place.
Yeah, I agree with that entirely. I feel like one of the great disservices that we do is refer people in this referral roulette until they find a place that can help them. And I think what Gina was saying about how you don't need, I mean, we all need to be experts. We all need to have at least, we don't need to be experts. We need to have a passing familiarity with our community and what we need. And the first thing is respect and access to basic services. I think there is a misconception that queer and trans people, and I say queer in an umbrella way to capture the entire queer alphabet. There's a misconception that members of our community are somehow inherently disordered, and that being queer and being trans is itself a mental illness, and that's categorically untrue. I think living farthest from justice and not having access to the same opportunities, even in the best times, means that when things are difficult, we are a community under strain. And I just want to recognize that incredible strength that Gina pointed out, which is that in terms of taking care of ourselves, this is something that all marginalized communities do very well. And talking to other folks and saying, is there a safe doctor? Or how do I get connected to this service? Or do you know anybody who's got a spare room that I can stay in? Or do you know anyone who's hiring? That community mutual aid, which is kind of the opposite of charity, it's when communities come together to take care of themselves, is a model that works very well when it's properly resourced. And bringing that into the public structure so that a lot more of those community resources and knowledge are harnessed, and so that folks from the community are employed doing these jobs, because there needs to be more than one Gina. There needs to be all of us who know how to provide care to this community, but we also need our community to be moved into these really stable and family supporting, benefit earning, pensionable jobs, so that the person you talk to on the phone is also a trans person. And that's not because you called the trans care center, it's because you phoned the help link and there's a person.
Yeah. And you know what, Adrienne, that's really good point, because so often I find those misconceptions are rooted in silence, right? It's the voices, collaboration, even the way that we look at our own structures. And I know the HEU, you folks are doing that in incredible ways, right? If we can look at our spaces and our structures, no matter what we're part of, that might be our local, that might be our union, that might be our workplace. We can learn more about the issues, the realities, and that's the core of the misconception. We need to hear it first, right? Just like Adrienne was saying, like we need to know that. And we need to make the space. And I think that's even what this is about, right? We're bringing voices forward to the table to address them, and then we can get ahead of those misconceptions.
And that's critical across the country. I think another misconception is that queer and trans issues only happen in my community. I'm right downtown Musqueam, Tsleil-Waututh, and Squamish territory, or that they're a little bit farther west in the West End only. And every single person who's joining this webinar tonight knows a queer or trans person. That person might not be out to them, but they're in your communities and they're everywhere. And we have an obligation to make sure that our family members and our community members feel like they're family members and community members, and not require folks to leave home in order to get culturally appropriate healthcare. That's not the model. It's keeping folks at home.
Yeah, so true. Well, what do you think then, Adrienne? What are the biggest challenges and opportunities then for, for change and for growth and for improvement?
Well, I think that we have learned first and foremost that hospital cleanliness actually was essential, and that the people who are doing the work, who don't, who've been undervalued for so long. I'm speaking, of course, to the fact that so many HEU members are just being brought back into the public system after a government just decided that this really critical aspect of healthcare infrastructure was somehow disposable or could be done more cheaply. And I everlasting shame on that government that decided that folks who provide nutrition and cleaning services in hospitals were somehow not essential. Then a pandemic happened. Turned out it's actually really important to have clean workplaces and clean healthcare facilities and clean everything. I think as we go forward from this place, and we're not going to go back. We're never going back to the way that it was. And that's the first devastating thing to come to terms with. We're never going back there. But we have the opportunity to vote, and to vote for political parties, and to participate in campaigns that are going to keep pressure on these critical infrastructure, health and wellness services that HEU members and others deliver, that keep people alive, literally. And that's not just a respirator, it's the whole suite of things. And focusing on that rather than, say, corporate tax cuts or stadium projects or folks who will never be legislated back because they're not essential. Actually, essential services being core as essential and funded appropriately, because there's no way that the world that we need is achievable unless there's core wellness, there's core housing, there's core employment, there's core access to services, including social services, which, I mean, the solutions to crime are housing, employment, wellness. The solutions to mental health emergencies are housing, employment, access to healthcare. We know this, and we've known this since the recovery from the Depression, which is a good model, when there was an increase in government spending temporarily to lead to some really important infrastructure that we're still using now, and then reasonable funding to keep services operating at less than more than just a bare bones level, because we were bare bones before 10 million Canadians applied for EI. Mm-hmm. We were bare bones before thousands of people died of an illness that was often preventable. Millions of people. And I think coming to terms with a world without those people requires a commitment to not let it happen like that again.
So powerful, Adrienne. Gina, I want to give you a chance to answer that, but I want to come back to that point if we can. Gina?
Yeah, absolutely. I think one thing, Barb, to think about too is whether that be a challenge or whatever we can explore further, but is really what I've been learning is the lack of representation at some of the healthcare benefits tables. I know it's sort of way out there, I thought, but oftentimes when we don't have the language or we don't have those services available, we might need to rely on looking to a challenge, to looking to developing memorandums of understanding for our agreements, to our contracts, to bring some of those equity conversations to the healthcare benefits programs. And oftentimes we don't look to those structures. But as Adrienne was saying, we're going through an unprecedented time where we have workers accessing unemployment, employment insurance, etc. Where are we accessing services and what services are available to us as support for mental health and wellness? And if it's not covered by some of our own coverage plans, where does it exist? In community, and in some cases we're talking about lack of access, which we've mentioned as well, or underfunding, or private practice. And as we know, public services are our strongest places, right, where we can make a difference. So I think that's one of the opportunities that goes with that, is if we can look to our own services to say, where have the challenges been? let's hear from our members. Let's hear from our communities so that we can look at our own public services and then enhance them so that, we're not left to, over the phone conversations only, etc. There's lots of places to find resources and support, but when we don't have those tools already, or if there's gaps, we need to hear about it. And then second, before I pass it, because I know let's go back to that piece, which is really the lack of data. So when we talk about the impacts to communities, we are working through this, day by day and evening by evening even. But we look at LGBTQ2+ workers, racialized workers, Black, trans, Indigenous workers, persons with disabilities, lower income individuals, and what are the impacts of the pandemic for our work, for accessing services, and there's a lack of data. So if these are the places that we can better understand, we can help shape the movement forward. Like Adrienne was saying, we can't go back. So then how do we build on that, but hear the stories? And so I would say those are some of the challenges, but then equally is how, what are those opportunities? Looking at bargaining, right? Are there bargaining fact sheets around mental health? We'll share some in the chat as well. Are there occupational health and mental health guidelines? Could we create some movement forward, just like you're doing with equity? So I think those are some of the opportunities that can help balance some of the challenges.
I had not expected to talk about benefit bargaining, but I'm excited to. I have an anecdote I'd like to share about a woman that I know. For folks who don't have a lot of background in transgender healthcare, a trans person is someone whose sex assignment is different than the gender that they feel. And this woman I'm talking about is in that position. She was assigned male at birth, which means she was born and everybody said it's a boy. And she grew up and decided, actually, that's not accurate. She's a woman and has always been a woman. And one of the kinds of critical healthcare that she consumes is cross-hormone treatment. So she takes one kind of medication that blocks the action of the hormones that she has on board, and she takes an estrogen supplement. And neither of those are covered by her union benefit plan. She has a full-time union job, but her benefit plan wasn't designed with this particular treatment in mind because there had never been a trans woman on the benefit bargaining committee. And I think for folks who can remember what happened when we started to bring in reasonable birth parent benefits and reasonable leave for people who are going to have a baby. People are like, oh, no one's ever had a baby in this mill. Well, of course, no one's ever had a baby in this mill because anybody who got pregnant in this mill left their job and then had to find another one later. And having women involved in bargaining for the first time and having loud voices and unions for people who are going to have babies who could bargain their own benefits and say, this is a human right. I shouldn't have to lose my job. I should be entitled to some kind of leave. And then to be able to come back there. We wrote these into all of our collective agreements and we wrote these into our benefit plans. We wrote them into the law of the province and of the nation. But it wasn't something that the people who were there at the table have thought of. And trans healthcare is similar. This is another reason why we also need folks with disabilities involved in crafting our plans. This is why we need experts who are folks from racialized communities to talk about what exactly it is that a collective agreement that meets their needs is going to look like. This is why we need an Indigenous perspective in benefit bargaining and the design of pensions and who sits on the bargaining committee. And luckily, we don't need to start from scratch because our members know this. Our community knows this. We hold this knowledge. And I want to point you towards, sorry, I'm getting it. I want to point you towards a resource, which is the Workers' Interest Handbook, put out by the Canadian Labour Congress, which should be appearing in the comment section, and a shout out to the unionized workers who are helping us with our comments today. Workers in Transition is a handbook issued by the Canadian Labour Congress, which is a guidebook for trans workers who are seeking to transition at workplace. It's also useful for stewards and union members who might not have a lot of background in how to support trans workers. And in the back, there's some sample collective agreement language that talks about what kinds of things the community wants. And you know why we have that? Because we asked trans people what they wanted, and they're like, oh, here's my wish list. And these are all of our work sites. People know exactly what they need. They just need to have it moved forward to the table. championed, and then we need to make the employer give it to us, and we need to make the government fund those things. And I think those last two steps happen when we have enough will behind us, and I can't imagine anything more that has brought us together more as a community than what has just happened to us globally. And the information that we need in order to respond to these really inadvertent holes in our benefit plans and our collective agreements are there in the workplace. So go talk to your coworkers and say, hey, what does your ideal plan look like? What benefits do you want? What would this workplace need to change into to be safer? And that's beyond a rainbow sticker on the wall. It's asking people's pronouns on the forms and moving away from binary mandatory intake on all of our forms and assuming that somebody's birth partner is their heterosexual husband, those things, which there's pockets of our community that know very deeply already, and we need to bring those folks in and actually have them be heard.
I love how this discussion is just organically going in this direction. So tell us a little bit more then about the initiatives to support wellness and LGBTQ2S plus people, and how well do you think they're working? Let's go to Gina first.
Okay, great question, Barb. I think, what are some of the initiatives? Well, I think our social service sector is thriving, right, in programs and services, no matter what, in each of our communities, or we have access to it online, etc. So I find that we either have, sorry, I think we're getting some feedback. We'll see, I think we'll figure it out with the mute. I think what happens is that our social service programs often ebb and flow with provincial or federal funding, etc. So I think coming back to that point about our public services, this is where we have the most traction, I think. This is a place where we have most investment in the wellness of communities. And I think the initiatives that are coming forward are really key. So they support wellness. We can look to them for best practices. And what I find too, coming out of the community health sector, is it's in these community health and social service places where we have housing addressed, addiction, mental health, wellness, food security, all of these pieces, programs and services in creative ways that address the social determinants of health. So right there, I think that's a great start, really valuable. Next, what I think is not only are they stitching together this safety net, not just in our society, but in service delivery, but I think promoting health and well-being happens through inclusive policy development. And I made sure I wrote that line down because really that is one of the key ways that we can, look forward, move forward together with any initiative, is we can ensure the sustainability of any initiative, campaign, program, or service through strong inclusive policy that values the voices, lives, and experiences of LGBTQ2+ members, not just union members, but also communities. So we can use that model, I think, no matter what, to help build some of the advancements to our own structure. Sorry, I've got the cat here. We can look at bylaws, our policies, our constitution, and I'm seeing that in the HEU. We see it across Canada. Like it's, I'm always delighted to see some of the changes and the work that you're doing, because we can't just rely on the community to do the work, but how do we work together in a stronger way with the community? So those initiatives, I think, going forward are about collaboration, working stronger together, looking at our own social responsibility and our own social investment in the wellness of members, not just in the union, but in the workplace and in the community. So I know there's a lot of things happening. There's lots that we could mention, and we'll put all kinds of wonderful things in the chat. But you're seeing national organizations like the CMHA, which is Canadian Mental Health Association, in a broader way, creating tools online where you can chat, you can get connected, you can have check-ins, all kinds of different ways that you can stay connected. But then as it shakes down across Canada and within our communities, there's the local programming. So I wanted to just mention one really neat one that folks can check out, which is in Manitoba. And so the local CMHA here is actually working with an Indigenous TwoSpirit program around mental health and wellness. And it's incorporating land-based teachings and services, and creating spaces in the community with and for LGBTQ2+ members. Those are CUPE members doing this work. So how amazing to see the ways that we can be creative and to build in perspective.
I want you to pat that cat for all of us, who's just making this panel so much more pleasant. I don't think we should all pretend that we're in some boardroom. I mean, we're sitting in each other's living rooms and at a card table in the laundry room. So just want to acknowledge that that's just so lovely. I have 3 examples about really a model forward. And the first is the Trans Lifeline, which is a crisis line staffed by trans people. It exists because mainstream suicide crisis hotlines failed us as a community. And so the community came together and made its own. And now you can phone and you can talk to a trans person as a trans person. Horrifically underfunded, but it is an example of that mutual aid that the community did it themselves in recognizing a shortage. I think the second thing I want to talk about is TransCare BC, which is an initiative of the PHSA, the Provincial Health Services Authority. It used to be that all trans healthcare in British Columbia happened out of Vancouver Coastal Health. And if you wanted trans healthcare, you had to go to Vancouver. Nonsense. Then the Liberal government just canceled the program and there was nowhere for people to go. The gender clinic closed, there was no pediatric care, there was nothing. And then TransCare BC was established as a provincial service that, like pediatric care and cancer care, was going to cover the whole province. And then it was properly funded. And then it harvested the knowledge that the community had by hiring trans people to work there. And now they have properly funded government jobs, which had been volunteer or unwaged positions in the community that are now lasting. And when you phone, there's a health navigator on the phone who's a union member who can help you to navigate this Byzantine structure, because no one should be expected to be an expert in healthcare architecture when you're phoning for wellness support. And not only will this connect folks to someone who will prescribe hormones or get you on the surgical wait list, but they'll connect you with a parent support group in Castlegar, or is there a trans women's group at a high school in Mission? And where do I send this person who needs to meet other non-binary folks in small community or downtown? And where can I get an inexpensive binder? And where is a good place to get clothes? And where is there a food bank that I can access? Shout out to the Sage Food Bank, which particularly is another one of those community collective efforts to meet a need. I think the third example I want to talk about, if I can toot my own horn a little bit, because of one of my hats is as the legal director of this place, is the Catherine White-Holman Wellness Center, which was an entirely volunteer-run health and wellness center by and for trans people. In the beginning, there were doctors, there were nurses, there was a legal clinic, there was a nutritionist, there's counselors. We have evolved a little bit, because there's suddenly some government funding for some of these things. So we've had to grow up and be a little bit more than just a collection of folks who came together on Sunday nights to make a clinic. But I'm delighted to announce that the Law Foundation, which is an organization that funds legal aid in British Columbia, has just given our legal clinic stable 3-year funding to pay for a full-time, 1 FTE, full-time equivalent legal aid lawyer. So now there's a funded legal clinic for trans people in all areas of law. You don't need to find a particular family law clinic or a wills clinic or this clinic. You just come. If you're a trans or non-binary, two-spirit, genderqueer person, it's the only place in British Columbia you can see a trans lawyer for free. And that happened because people who had been filling this mutual aid gap by volunteering, I volunteered there for 10 years, now are properly funded. And it's the TransCare model, it's this Catherine White Home and Wellness model, it's places like the Trans Lifeline that exist already that need proper funding, that need the community to be able to do the work that it was doing before and to continue to do that in a stable way. And what we're finding now that we can pay people a living wage is that they burn out less often and they provide better care and they're able to buy groceries. And the community is better for it. And it is so different than another thing that's happening, which is that, you know, trans people are a little bit popular at the moment. And people are like, I'm going to open a trans clinic and it's going to be great. And we're not going to have any trans people that work there. Well, no, of course, that's not going to work. You don't have an Indigenous healing center without having Indigenous people work there. You don't have a women's center without having women work there. And I think folding those existing community resources into the public system and funding them properly and making those positions sustainable, and having a buffer in there to recognize that this is a vicarious trauma field that we all exist in, and that a mental health day is a sick day, and you're going to need more than 3 of them.
So well said, Adrienne. Thank you so much for that. That was truly profound. We don't have a lot of time left. We need to spend some time with folks with questions, but I have a really important question for both of you. What else can people do to get involved? Where can we go for more learning and resources, both for LGBTQ2S plus people, but for others as well? Where can we go?
Do you want me to start here? Sure. All right. I think one of the first places we can go as members, we're here today, right, is look to our equity committees, the work that we're doing right here. You know, host a working group, do a scan of what's available in our community. You know, work with Neil at United Way BC, right, to identify some of the pillars in your community and then get in touch with them. I think that's really valuable. Like, understand who our community is. Let's get in touch with them, ask those questions, develop a survey to ask them about their services, and let's help shape what's out there. I think advocating is a huge part of the work. What can we do to get involved? Each one of us, the work that we do is important. So looking at, you know, mental health first aid courses, having steward training, where can we enhance it? How do we offer that type of, those types of resources? But then I think ensuring that there's mental health resources and wellness resources available. So it might be collaborating with 211 BC. For members, so that HEU members, friends, family have connection to services 24 hours a day. I would say those are 2 really quick ways of getting started. What can we do? Take a look at our community and build that relationship.
I have 3 things. The first is we're here today to talk about 2S LGBTQ mental health care. But if those acronyms, if those letters in the queer alphabet aren't something that you know, find a credible 2S LGBT organization in your community, go to their website, read the glossary, figure out what those words mean. First thing, educate yourself. Dr. Google has so much information about how to be culturally safe and lovely to our community, often written by us. So find those resources and read them. I think a good source of rights is www.transrightsbc.ca that explains the legal aspects of things. I have to say that because I'm a lawyer. Here's your legal part. I think the second thing that's important to us and critical for us as workers is to get out of the boxes that we're in and think, I'm at home now, I'm at work now, I'm doing social things now, if that ever happens outside of Zoom, and realize that the political action that our unions are doing are critical, because healthcare is housing, healthcare is education funding, healthcare is wellness beyond just a hospital. And we have the power to advocate for those things collectively, and they make society better for all of us. I think the third thing is to do mutual aid, because when these systems that we've built after the war fail us, what it's going to come down to is you and your neighbor. And mutual aid means you make sure that that family at the end of your block has a bag of groceries, I knock on my neighbor's door when I'm going to the vaccine clinic and take her there on her walker. Do that and behave like you're in a community. Behave like your neighbors are your family, because they are.
Oh, that's so lovely. Thank you so much. I have one more question, and I probably can come up with several more. Do we have any questions from the live audience that we have? Is there a plan to change the intake forms in Interior Health or other health authorities? I'm not so sure. I don't know. Adrienne or Gina, do you know the answer to that?
I think we just made a plan, and I'm keen to help. If there's
Okay.
activists on the ground there, please phone your rep, because we can make some phone calls and say, this form is problematic for these human rights reasons. And then they change.
Awesome. Yeah, go ahead, Gina.
Yeah, I think further to that is it's that internal look, like we were talking about. How do we look at our structures? Are there agreements that we need to look at? Does the language need to shift? Could we look at some best practice language? Those types of things. And I think no matter what with forms is building, we need to ask those questions. We've talked about that a couple times, right? We have the tables built, we're bringing people together. How do we look at that? Maybe it's through a working group. That's how I've done it in the past, which is looking to our forms. Those are the very first places that whether that be members or folks accessing services see us, and it communicates a safer, inclusive space. So I think those are some great places. And then it's the structure. So then back it up with the policy, make those changes, look at the process so that it doesn't just live with us who are here right now, but that it continues to evolve and it's put in place. So yeah, I'd add that.
A great example of what this has looked like in a healthcare context is the vaccine passport, which is a really good idea, and they keep us safe. Vaccine passports and vaccination programs are good public health. There was a glitch in the MSP system, which means that some folks who are getting passports who have already changed their names legally are getting their old names displayed on vaccine passports. And this happened hundreds of times. And then people spoke to their government and said, hey, here's a problem. And the government was like, oh, yeah, you're right. That's a problem. Let's get the experts and databases on this. And they've been working hard all weekend. And I understand that we're near a back end fix for that, which I think is super fantastic for trans people in British Columbia. But it's a question of actually having that knowledge that's already on the ground. Like, I see these forms every day and I think they're wrong, and getting them to a decision maker that can do that. And the committees are a good way to do that. Your union is a good way to do that. Your local elected officials are a good way to do that. If you don't know who those people are, start with the steward in your workplace and say, hey, can we send this up the chain? Is there somebody talking about it? Because you are not the only one who has noticed that this form needs help.
So the answer to the question is organize. I love it. That is some really amazing, like tangible answers to that. And I hope Adina and I know Adina will actually take this and run. No doubt about it. Okay, so I am just looking for other questions. But you know what? There was one question on, and I know that there was a resource put into the chat. But I just want to give Gina, perhaps maybe you can have an opportunity to explain what 2S means.
Yeah, absolutely. We shared, I believe there was a link shared in the chat for a bit further. So TwoSpirit was the term. So we mentioned that's the 2S that you see in the acronym. And sorry, there's a lot of sound happening here. It's quite a busy night at my place, it turns out. Someone's working on the front of the house at this moment. So my apologies if you're hearing some background noise. So we shared a link for the TwoSpirit Society of Manitoba. And the TwoSpirit term is one that is not just assumed. It's one that embodies an individual that embodies the spirit of both male, female, woman, man, is a spiritual term. It's not something that is immediately assigned to an Indigenous person. It's something that someone embodies, and it's a spiritual term And it's a term that actually originated in the prairies. The actual term TwoSpirit was originated many years ago through a discussion where TwoSpirit folks were gathering here in Manitoba and Saskatchewan. And so when we look at the history and the impact of colonization on the diversity of people upon first contact, etc., there were really binary terms that came forward. Men, women, and TwoSpirit people who embodied this that term was quickly shifted with this new structure that was pushed and imposed, and that's the act of colonization. And it was a term that came forward again in the last 25 years to reclaim that identity and reclaim that sense of self. And as spiritual leaders in the community, I think, especially in the prairies where I'm coming from in Treaty 1, it's a term that is of great recognition, and is really nice to see that people are open and just really celebrating the reclamation of that term.
And here on the coast where I am in Salish territory, there's also many nations that had many ways of being in the world. And I think it is easy for people who are settlers to forget how colonial a gender binary is and a sex binary, and assuming that your sex and your gender are somehow inexplicably linked together. And decolonizing the way that we think about each other and our bodies, it can be an act of decolonization, and that's really important.
All right, so we have just enough time for us to leave this on a really, really good note. So my last question is to both of you, and we'll start with you, Adrienne. What gives you hope?
I want to thank you for the question, because I think a lot of us who are activists in the movement forget to celebrate. We just move on to the next crisis. I am so happy about the way that our communities took care of each other when it was necessary, and it's still necessary. And I think in my own life, the number of people who I have not heard from in sometimes years, who when the pandemic lockdown began, just checked in, and they sent a Facebook message or they sent a text, and they're like, hey, how are you doing? Do you have everything you need? How's being stuck in your house? Because I don't have a job that required me to go to a place, and I just want to recognize frontline workers who have to go there every day, and check in and make sure that you're okay. But I think the way that we took care of each other is such a good model for humanity, because that wasn't a part of my life before, that everybody just texted to check, and that hasn't ended. I think for people who are growing up in this, I've got a number of clients who are children and youth, who it's just normal that you text each other and make sure that you're all going to be okay and that you'll all get to the event together, and to check in after something happens. And I did not feel that when I was that age, that you'd be in a meeting and something super offensive would happen and someone would text you and be like, hey, how are you feeling after that? Are you okay? But taking care of each other is a value now. And I'm excited about that, because it's how we're going to get through whatever this new world is that we're watching be born now. And I think watching even things like online like clothing swap Facebook groups, who are now like, oh, do you have wipes? I have wipes. Do you want wipes? I have toilet paper. Can I bring some to your house? And the way that these spaces that were used for something else have just been now turned into mutual aid community care portals, in the way that so many HEU members are doing as their job, but we're now also doing this at home. I think that's just so lovely, and it restores my faith in humanity as just like a caring community and not a series of rational individuals. We're family.
Beautifully said. Gina, what gives you hope?
Oh wow, yeah, that was great, Adrienne. It's that collective strength, right? It's how we come together, and Adrienne, while you were talking, I was thinking, yeah, we've done that. And you find and create community. And through the pandemic, like as an out LGBTQ2+ person, as a queer person, community was where we met up. Community was where we connected in places where we don't have that same opportunity in society or in any community. But we created spaces and we met up in places. You know, I'm in Manitoba, and things are still quite locked down in different ways, right, between our provinces and communities. And so that idea of finding collective strength and collective efforts and coming together, we're finding online, but it feels like it's held back in some way, right, in those meeting and mixing places. So then where we turn is to the strength of helping each other through it, like Adrienne was saying, right? And that's the history of the social service sector, is unionized people coming together and building that sector, right? It's building the party. It's building, you know, I come from Winnipeg and Treaty 1, and, you know, the Winnipeg General Strike helped open up that world, right? It developed the social service sector, and it was working people like ourselves working together with the Women's Labor League, working together with the YMYWCA back then, and creating programming. And this time reminds me of the Winnipeg General Strike, because it was 100 years in 2019. And I did a lot of research and all kinds of stuff for our work. But what we learned is now, fast forward a couple of years, people came together in the same ways, right? You know, 30,000 workers don't just walk out of workplaces without a collective effort. And then when it was going on for 6 weeks, it was members, equity workers, that came together and had soup kitchens and fed, you know, women and children. And, you know, like, these are the ways, and that's that mutual aid, Adrienne. Like, it's the way that we come together to say, you know, we can stitch this community together. So I think it's that collective effort. It's progressive. But what I'm finding now is it's the union. So for me, right, the union is the place where we have job security. We can advance the language. When we have regressive legislation, it's the union that can bring that forward through our agreements. We build the conversation. We have the space to talk. And so really what gives me hope is that the collective efforts of this movement is what is going to make it. Because we can do all the work we can, help get governments elected, advance our collective agreements, make sure our bylaws are inclusive, look at our codes of conduct and make sure they're representative, they're structures that represent and protect our workers when we need to most. And I think it's us coming together as unionized workers to make this happen. So it gives me hope to say, like, I can join you here today and say, let's do this work together. We are doing this work together. And it's just, I don't know, it's just the way forward as workers.
I'm so glad that you mentioned the Winnipeg General Strike, because it was also when there was a global pandemic and the influenza epidemic was really ravaging. And out of that catastrophe, I met a woman at a conference somewhere who told me that her grandparents had met when her grandmother was delivering a casserole to the men who were in jail after the RCMP stopped the trains. And then they had a family, and then they built this like this wonderful person who I happened to meet, who's also in my family because we're in the trade union movement. And I think those things are great reminders that it doesn't need to be heroic. It doesn't need to be legendary. You don't need to be necessarily marching in the street. You can change the world with a casserole.
That's a beautiful story. Thank you, Adrienne. Like, I absolutely hate that we're running out of time. We have all but 2 minutes left. That has to have been like just such a truly inspiring and deeply, richly educational hour that you have spent with us. And I just feel like we could keep on talking, that there's so much more that we can talk about. But I really, truly appreciate how you brought it all together. You connected it all together with the labor movement, social justice, and our personal, helping our neighbors and being there for each other. That was absolutely spectacular. And you may not want to toot your own horn, either one of you. I know you both well enough that, you don't, but we need to do it for you. You're both incredible humans, and we are a richer, province and country as a result of the work that you do. And we just want to thank you so much for being here tonight, but more importantly, for the work that you do and the change that you make in the world. Your impact has been tremendous. So we have to leave it at that, though, for today. Again, thank you both, but thank you all for watching. And I also want to thank the Pink Triangle Committee at HEU for all that you do, and all of the activists that support wellness in LGBTQ2S plus communities at this time. Just going to say that there is an opportunity for you to provide feedback. I'll have the wonderful staff. They have been working so hard behind the scenes, putting the links in the chats and making sure that, we're staying on track. A huge shout out to them. Just a tremendous job. We would love to hear back from folks, have your feedback on this, and also know that this has been recorded and it will be available for you to share with other people so that they can watch and also take advantage of, this wonderful, amazing, inspiring, and educational hour. With that, I will say goodnight to everyone. Thank you so much yet again. That was beautiful. Take care, my friends.